Hi everyone, my name is Dr. Igor and I'm a clinical oncologist practicing since 2010. Our today's topic is gluten, celiac disease and gluten-associated diseases. If you have diarrhea, weight loss, bloating, anemia, osteoporosis, skin problems, anxiety, depression, infertility, any vitamin deficiencies, this video may be very interesting for you. The thing is that genetically modified plants that we use for food, for example wheat, they all give good harvest, they all survive severe conditions, but they have their problems. And the most well-known problem is the presence of high amounts of gluten. This substance comes to the gut and causes inflammation and autoimmune conditions. The inflammation in the gut with atrophy of the gut wall and subsequently with the different autoimmune conditions, microbiome diseases, vitamin deficiencies, malabsorption, abdominal pain, diarrhea, skin problems, and neurologic and psychiatric problems. And this is the first video of two video series. Here we will talk about the gluten hypersensitivity, sensitivity, about celiac disease, and about the symptoms, signs, and diagnosis of these conditions. In second video, we will talk about gluten-free diet. Is it so good or is it just a hype? Is it worth following it for everyone? Or is it only for those people who have celiac disease? What's the problem connected to this diet? Why this diet is not so good for everyone? So please subscribe not to miss any important information. Let's get started. So again, the main gluten sources in the food are wheat, rye, barley, and the gluten may be contained in contaminated oats. The thing is that oats normally don't contain gluten, but they can grow near the fields where the gluten-containing plants grow. That's why it can be contaminated. Also, some sauces may contain gluten, some drugs, dietary supplements, and processed meat. Sometimes some yogurts, especially with different added substances, aromatizers, may contain gluten too. So always watch if you buy yogurt in the shop, always watch if it's gluten-free or not. And the thing is that all this number of diseases associated with gluten ingestion, they may have different symptoms, not only connected to the gut. First of all, if the person is genetically predisposed for gluten hypersensitivity or for celiac disease, then he will get inflammation here. This is the piece of the wall of the gut. The gut has microvilli that will increase the absorption and digestion of the food. So all the nutrients, all the microelements, vitamins will be absorbed freely. But when there is inflammation, chronic inflammation, and also in celiac disease, we see the immune cells that will be present here. And with the course of time, there will be atrophy of this villi. So the digestion will be impaired. Their absorption of vitamins, minerals, and nutrients will be impaired. And you can see the damaged villi here. Also, with this inflammation, we see there problems with microbiome, and we see problems with leaky gut. And it's worth mentioning that only in 1 from 8 patients suffering from these conditions will be abdominal symptoms, like, for example, abdominal pain or malabsorption, diarrhea, weight loss. All the others will have different symptoms, so majority will have different symptoms. For example, if these are kids, they can be growth retardation, they can be anemia, iron deficiency, folate deficiency, because their vitamins won't be absorbed in the gut, osteoporosis, again, vitamin D absorption problems and calcium absorption problems, and phosphorus. Then dermatitis, herpetiformis, and aphthous stomatitis. I will show you the pictures now. If you're easily traumatized by unpleasant pictures, close your eyes. I will show it. Wait, now I show. Yeah, this is the skin. So it's inflammation of skin and problems inside the mucous membranes. Okay, no pictures anymore. You can watch it again. Next, neurologic symptoms. Again, that can be most common is gait ataxia. This is the damage to cerebellum, which is needed to make movements more precise, but if it's damaged, the person may have gait ataxia. And neuropathy. This is damage to neural tissue, to nerves. And psychiatric manifestations like anxiety or depression are being the most common. Also, there can be infertility and different vitamin deficiencies, and every vitamin deficiency has its own symptoms like dermatitis, hair loss, dry skin, etc. Also, the person may have chronic fatigue, headache, foggy mind, and head and leg numbness, because of these problems of the damage of nervous system. This is the table on diagnosis of different diseases connected to sensitivity to gluten. By the way, there will be the links to the articles that are the sources for this video, so you can read more, you can get more information if you are interested. For diagnosis of celiac disease, anti-transglutaminase antibodies are used and anti-endomysium as a confirmatory test, but also the genetic testing, HLA testing subtype to see who is prone to celiac disease. By the way, from 1 to 1.5% of population has celiac disease and doesn't know about it, because most of the signs are not in the belly. Also, the source is a belly inflammation in the gut. Next, if the person has the upper endoscopy, they take the biopsy of the mucous membranes of the gut and they see the lots of immune cells in the gut wall, and atrophy. And usually after implementing the gluten-free diet in these people, they do the biopsy again in half a year or in a year and a half and see if the picture is better. But mostly the inflammation doesn't go away completely, but there is some improvement. Next, there is a wheat allergy and non-celiac gluten sensitivity. Anti-gliadin antibodies are present in 50% of cases, but these things are for gastroenterologists. So if you suspect any of these diseases, you must go to gastroenterologist, so he will rule out the problem in your case. That's all for today. I hope it was interesting for you. Bye bye.